2, 1.
Hi. So imagine you're going into a doctor's appointment and you have something that's going wrong. So you make the appointment and you go in, and the doctor says, well, we obviously need to schedule some follow-ups. We need to have you go to maybe a lab service. Maybe he wants a CT scan. Maybe he has some prescriptions that he'd like you to take and some follow-up visits that need to be scheduled. So maybe you leave that doctor's office visit with about 5 more things to do than when you went in there. Well, how are we going to get this done? You know, if we talk about scheduling those appointments and doing the follow-ups and doing everything like that, you know, maybe you're sick, maybe you're injured, and maybe you don't have that ability to go coordinate and be the medical billing specialist at the top of your game that you need to be right at that moment in order to do all these appointments. And so what we have, what Renown and Senior Care Plus have done to answer that is set up personal assistants. And so these people coordinate medical care with you to help schedule those follow-up visits, to help schedule those prescription fill-ups, to make sure that that CT scan and that MRI or whatever it is gets scheduled, gets attended, and they follow up with you and with your doctor to make sure that everything works out well for you, especially maybe at your most vulnerable time when you're going in and needing those medical services. So today I'm going to be going through with a renowned Senior Care Plus personal assistant, Jordanne Pena. And my name is Alex Sampson. I'm with Health Benefits Associates. I help people with Medicare plans, small business and large business health insurance plans, and individual health insurance plans for people under 65 years old. We have offices here in Reno, in Sparks, and in Carson City. Now these YouTube presentations are set up the way they are. We're doing this live, so if you're watching this live, we definitely want you to participate along with us and actually ask questions in the chat box. Now, I'll try to get to as many of those questions as possible, and so if you have any questions that are popping up in your mind right now, please feel free to ask those in the chat. Also, we're doing these presentations online because obviously COVID's here, but also to get to as many people as possible in the format that they need. The whole goal of these presentations and of everything we do at Health Benefits is to connect people with the care that they need. And so whether that be the doctors through the personal assistants that we have today, or whether that's a lab service or medical service, you know, whether that's the health insurance plans that we offer that help connect those things, or the Medicare presentations that we'll be putting on this year, all of that is in an effort to help connect people with doctors. Now, about Medicare specifically, we're going to be having a Hello Health continuation called Mastering Medicare, and it will be online on YouTube Live just like these are, and those will be specifically about Medicare and the differences that are coming up, those changes that are coming up starting September 15th. And so please tune in for those. There are a lot of changes here in Northern Nevada that are coming up, and we want to make sure that you're completely aware of those. And so now I'm going to actually introduce Jordanne here and have her, just introduce her and go to any Q&A that we have about her. Now, Jordanne, are you on the line here?
I'm here.
Okay, great. Now, Jordanne, I received your bio, but I actually wanted to kind of stress how you are different than a standard customer service person. Now, not that customer service 1-800 numbers are bad, but having somebody local in town who is actually have a degree in public health, who can actually coordinate those medical services, I mean, that is night and day different than, just having a friend calling on your behalf. So kind of tell me a little bit about yourself, about your background, your education.
Right, so I am a native Nevadan. I've lived here my whole life. I went to the University of Nevada, Reno. I graduated in 2019 with my Bachelor's of Science. I studied public health, and then while at the university, I also got my minor and certificate in gerontology, and worked with their program that they have at the university for our older adults.
Good. All right. Perfect. Um, well, already got one question actually here from Michelle. I love MyChart. How does the personal assistant integrate with MyChart? So, can you speak a little bit about that?
Right, yeah, absolutely. So we are all able to see your My Chart, any messages that you might be sending to your doctor. If you're doing any appointment requests or things through My Chart, we can help schedule those. And then we also do some of our outreach through My Chart, such as the comprehensive health assessments that we're scheduling right now. So we're able to use it that way.
Perfect. And that kind of integration, I mean, to be able to have the personal touch along with the technology, I mean, that's the perfect pair, isn't it? And like to be able to go on, let's say you want to see it at midnight on a Sunday, well, you can go online to MyChart and see that and see those. But then if you need to talk to somebody, you need to have that human touch, you're available, during the standard hours to be able to actually connect with people.
Yes, exactly.
Awesome. Well, I have one other question here, and I think I'll be able to answer this, and you let me know if I'm if I'm off here. This is on live, so no room for error. But do personal assistants help people with Medicare supplement plans? I have the Plan F, and so actually, personal assistants are unable, if I'm not mistaken, to help with Medicare supplement plans, and so these work with the Senior Care Plus plans that are out there. And so you do need to be a Senior Care Plus member to utilize the personal assistant. Is that correct, Jordan?
Yes, that's correct.
Okay. All right. Perfect. And a lot of those members, I mean, if you're looking into that kind of plan, I definitely want to help do that. And I can help members compare those plans versus the Plan F, show you the pros and cons, and go through all those with you. So, or anybody at my office, by the way, can help do that. We're all licensed here. So one other question. Let's get to those. Let's see. You mentioned you're here in Reno. Are you at the South Meadows office? Are there different locations for different personal assistants? So do you know about that?
Right. So I work directly with our South Meadows patients, but we have a Senior Care Plus personal assistant available at all renowned clinics. So this includes our 2 clinics that we have in Carson as well.
Got it. And so, and I want to. That kind of brings up a good point. So you base these clinics, these locations on the clinics. Is that right? So you have dedicated people per clinic.
That's correct.
Okay. And so these people follow up with patients that have gone to that clinic or have that clinic assigned as their primary care clinic. Is that right?
Yes, we follow up with those Senior Care Plus patients who have a primary care provider at that specific clinic location.
Understood. Okay, and I can't stress. I also want to talk to you just really quick. I've even though this program is as new as it is, and I know it's very new, I've already gotten feedback from my Senior Care Plus members to talk about how great it is to have somebody who is what they called it. This personal person called it running quarterback, and I loved that their analogy here that somebody was running quarterback for their healthcare. Just like they have a team of healthcare experts over at Renown, but they need somebody to be handling the ball, somebody to be that quarterback to coordinate the care, to help with that. And so obviously, it's up to the members to take a certain responsibility and role, and that isn't going away, but it is that much more important to have somebody who is that expert in medical care, medical coordination, to have somebody who has a degree in public health. I mean, you can ask your neighbor to help you with the plans, but they don't have a degree in public health like you do, right?
Right.
Right. So, the feedback I've gotten has been amazing, and I love I love this ability that we're having today to introduce you and to showcase kind of that difference versus a lot of other systems out there that don't have it. So, let me get to a couple more questions here. Let's see, close relationship. So, did Renown set it up this way so you can have a close relationship with the patients? And so do you have the patient's direct number? Do you make those outgoing calls to them?
Yes, so Renown and Senior Care Plus set it up this way, so each clinic has that one person who they know they're calling, and we can have that personal touch. Since we have access to their My Chart and charts with Renown, we can see their telephone numbers, and we do outreach that way. And going back to My Chart, we always can use My Chart as a form of outreach too, if that patient does have an active My Chart account.
Nice. Nice. Okay. And so are they calling just back into the general number when they give you a call and then being routed to you, or how, how much is this? How direct is this?
Right. So all Senior Care Plus personal assistants have a direct line that their patients can call. And if we're leaving voicemails or messages for them, we leave that number so they're able to reach back out to us directly and don't have to go through a confusing phone tree.
Oh man, that's amazing. Now I've had a lot of people who I've talked to who have somebody else, especially when they're in need of care. They have somebody else who's basically running that system, trying to navigate the healthcare system for them, and it's difficult to say the least. And so to have somebody like you who's on that, I mean, these people have taken days, weeks even to coordinate something that I imagine you, with access to my chart on your side, could probably get done in an hour or two. I mean, have you heard the same?
Right, yes, I have. So a lot of our patients, they might call in and feel like they have a very difficult problem that's going to take forever to fix. And the personal assistant program, we're well versed with their insurance as well as their health care and their primary care providers. So we can offer same day resolution. We try to do one call resolution as well for our members so we can get everything fixed within a 10 to 15-minute phone call, but we stay on the phone as long as we need to in order to make sure that they are taken care of and their problem gets solved.
Perfect. Yeah. So I have is it Michelle here asking, I have Senior Care Plus, can I make you my personal assistant? And so how do they how do they connect with you? How do they connect with their personal assistant, or what's the process here?
Right. So she can find out who her personal assistant is. She can either call us at 775-982-3112, or she can go onto the Senior Care Plus website, and under the resource tab, there is an option that says personal assistant. And if you click on that, it will bring you a list of our renowned clinics. You click on the clinic that you go to, and it will pull up the personal assistant's headshot, their direct line, and a biography about them, so you can call that way as well.
You know what I'll do? I'll also include a link to the personal assistance page with Renowned Senior Care Plus in the description below. And so I'll include all of that as well as the phone number and any additional information for anybody who needs it. So that'll be on there as well. And so let's see if I've got some other questions. These questions, I had a few questions for you, but you know what? These questions are actually coming in pretty well right now. And so I think it's more important to get to the members' questions than definitely more important to get to theirs than mine. What kind of issues do you help with? What is the most complex issue you've dealt with? And so I know you can't get into specifics too much here, but I mean, just give us a general idea.
Right. So Senior Care Plus personal assistants help with a range of things. We help with scheduling appointments, certain specialty exams. We can help with arranging transportation. I mean, we can help with any benefit questions you might have, billing questions or claim questions. We are a one-stop shop for your health care. I would just say it ranges, but we always have all of our resources and great supervisors available to us to help solve your problem and get you that one-call resolution.
Perfect. Yeah, I was actually looking at the questions. I guarantee you, I wasn't checking my phone here. But no, these are great questions that are coming in, and I think that your role at Senior Care Plus and at Renown is just absolutely vital. So you've mentioned that you have these different clinics set up. So, and I mentioned that it started recently here. So did it start just recently this year? And then how many clinics, or not number wise, but as far as how many people are available to help in your role at Senior Care Plus Renown?
Right. So this started as a pilot program in April of 2019, and we had 3 personal assistants who were doing the pilot program. And then in September of 2019, the program rolled out and personal assistants were assigned to every clinic. So if for some reason I'm out of the office sick or on a lunch break or just on the phone with another patient, we have other personal assistants from other locations that can take that call and do the same job I do and can help give you that one call resolution and assist or take a message and help with whatever they're able to.
Okay. And I have a question here from Maria. I'm confused. Do you talk directly to my doctor when you resolve something, or do I notify them?
Right. So we talk directly to the doctor. We have access to the doctor's office phone number, and we talk to the doctor through MyChart or email, whatever it may be, to help the member and not make the member a middleman. So we do it
Perfect.
all.
Perfect. So when you're talking about your role there, do you enroll new members in to Senior Care Plus, or are you more you deal directly with existing members?
So we deal directly with existing members. We can help existing members make changes to their plans during annual election period or open enrollment. We don't help enroll new members just because we're not licensed agents.
Okay, perfect. And that's where you would work well with one of us here in my office. We can definitely help enroll those new members if you are new to Senior Care Plus. You know, if you're an existing member, absolutely, Jordan's going to be, or your personal assistant is going to be a great resource to reach out to for any of those plan changes here. Member wants to find their personal assistant. So, yeah, I think we're almost running through all the questions here. I've got one more. Can you order prescriptions for me? I need help getting my mail order drugs on my plan.
Yeah, awesome. That's something that personal assistants help with, and a lot of us do in our day-to-day work. You're able to give us a call. We can get you switched over to mail order, get your account and everything all set up for you. So we're all happy to help with that.
Perfect. And then how much does it cost? How much additional does it cost to add a personal assistant? Are you free? Are you included with the plan?
We are completely free, included in the plan, so there's no extra cost to the member.
Okay, yeah. And by the way, not free. There's no cost. Sorry, that's a little bit of a correction. I have to make sure we maintain compliance here. So it's no additional cost. We can't say obviously that anything was free on the plan. So, and then one thing, let's see. Actually, I think that about wraps it up. I went through quite a few questions. I know that we only have a certain amount of time. I want to be totally respectful about your time so that you can get back to those members who you are the personal assistant for. Also, I wanted to know if you are watching this as a recorded session, I just wanted to reach out to you to say, make sure to subscribe to the channel. Next time we go live, you'll be notified if you actually subscribe to the channel. That way you can get your questions answered. We have this interview going on with the personal assistants, but we have more presentations coming up here with other doctors that I'm sure you'll want to be part of, and you can by subscribing to the channel, and then when we go live, just typing your question in and answering those doctors or medical professionals that we interview. So, Jordan, thank you for coming on. I can't thank you enough for your time, and I think your role with Senior Care Plus and Renown is just absolutely amazing. You've made my life a lot easier, obviously. I'm sure that you've made all of your members' lives a lot easier, and so thank you. So thank you for everything that you do.
Yes, thank you for having me today.
Yeah, absolutely. Well, thank you for tuning in to this week's Hello Health presentation. If you have any questions about anything went over, we would love to hear it. Please leave it in the comment section below. Also, please subscribe to the channel if you need more information. And if you like this video, please hit that thumbs up button right below me to show your care and support. We're a local company here in Northern Nevada, and we would love that support from you to help put on and continue these presentations. Thank you again for tuning in. I'm Alex Sampson with Health Benefits Associates.